Post-traumatic stress disorder, PTSD, is a complex mental health condition that can occur after experiencing or witnessing a traumatic event. While PTSD can affect anyone, recent research indicates that autistic women are particularly vulnerable to this disorder. This video explores the multifaceted reasons behind the heightened risk of PTSD among autistic women, examining factors such as victimization, neurobiological differences, emotional regulation challenges, and social dynamics. The intersection of autism and PTSD. Research has shown that autistic individuals are more likely to experience PTSD than their non-autistic peers. Studies indicate that approximately 32% to 45% of autistic individuals report symptoms consistent with PTSD, compared to about 4% to 4.5% in the general population. This disparity is especially pronounced among women who face unique challenges that increase their vulnerability to both trauma and the development of PTSD. Victimization and trauma exposure. One of the primary reasons for the increased risk of PTSD in autistic women is their heightened exposure to victimization. Autistic individuals often experience bullying, intimate partner violence, and other forms of interpersonal trauma at significantly higher rates than their neurotypical counterparts. For instance, research has found that autistic women are 1.5 times more likely to be victimized than non-autistic women. This increased risk stems from various factors, including difficulties in social reasoning, misinterpretation of social cues, and a tendency to take things literally, which can make them more susceptible to exploitation and abuse. The trauma experienced by autistic women can take many forms, including bullying. Many autistic individuals face bullying in educational and social settings. Physical and sexual abuse. Autistic women report higher rates of sexual assault during adolescence compared to their peers. Social isolation. The challenges in forming and maintaining friendships can lead to feelings of isolation, exacerbating the effects of trauma. Neurobiological factors. Neurobiological differences also contribute significantly to the increased risk of PTSD among autistic women. Research indicates that the amygdala, an area of the brain involved in processing emotions and fear responses, may be hyperactive in autistic individuals following traumatic experiences. This hyperactivity can lead to heightened anxiety and difficulty regulating emotions, both of which are critical factors in the development of PTSD. Sensory sensitivities. Autistic individuals often exhibit sensory sensitivities that can amplify their responses to traumatic events. Autistic women can experience several of the following symptoms that enhance trauma reactivity. Hyperarousal. After trauma, the nervous system may remain in a state of hyperarousal, making individuals more reactive to sensory stimuli. Intense emotional responses. Difficulties in emotional regulation can lead to overwhelming feelings of distress when faced with reminders of trauma. These neurobiological characteristics make it challenging for autistic women to process traumatic experiences effectively, increasing the likelihood of developing PTSD. Emotional regulation challenges. Emotional regulation is another critical factor influencing the risk of PTSD among autistic women. Autistic individuals often struggle with identifying and managing their emotions due to differences in brain chemistry and sensory processing. This difficulty can manifest as increased emotional intensity. Autistic women may experience emotions more intensely than others, making it harder for them to cope with stressors. Dissociation. A common trauma response is dissociation, where individuals feel detached from themselves or their surroundings. This can be particularly pronounced in autistic individuals who already experience challenges with self-awareness. The inability to self-soothe or effectively manage intense emotions can lead to maladaptive coping strategies, such as substance abuse or self-harm, which further complicate recovery from trauma. Social dynamics and support systems. Social dynamics play a crucial role in understanding why autistic women are at greater risk for PTSD. Many autistic individuals face difficulties in social communication and interaction, which can hinder their ability to seek support after experiencing trauma. Factors contributing to this challenge include misunderstandings. Autistic women may struggle to articulate their feelings or experiences related to trauma, leading others to minimize or dismiss their concerns. Isolation. The social difficulties inherent in autism may result in fewer supportive relationships, leaving these individuals without a robust support network during times of crisis. The lack of social support is a well-documented risk factor for developing PTSD. Thus, autistic women's challenges in forming connections can exacerbate their vulnerability. Cumulative trauma. Cumulative trauma refers to the accumulation of multiple traumatic experiences over time. Research indicates that autistic individuals are more likely to experience cumulative trauma due to ongoing victimization and social marginalization. This cumulative effect can lead to more severe PTSD symptoms, as each new trauma compounds the psychological impact of previous ones. Treatment considerations. Understanding the unique experiences of autistic women with PTSD is essential for effective treatment. Traditional approaches may not adequately address the specific needs of this population. Key considerations include tailored therapeutic approaches. Therapy should be adapted for communication styles and sensory sensitivities unique to autistic individuals. Longer treatment duration. Autistic patients may benefit from longer therapy sessions with regular breaks to accommodate their processing needs. Focus on trauma-informed care. It is crucial for mental health professionals to employ trauma-informed care practices that recognize the interplay between autism and trauma. Considerations for systemic change. The heightened risk of PTSD among autistic women is a complex interplay of victimization rates, neurobiological factors, emotional regulation challenges, and social dynamics. Understanding these factors is essential for developing effective interventions and support systems tailored specifically for this vulnerable population. As awareness grows regarding the unique experiences faced by autistic women, so too does the need for specialized approaches that address their mental health needs comprehensively. By fostering an environment that prioritizes understanding and support, we can work towards reducing the incidence of PTSD among autistic women and improving their overall quality of life. If you enjoyed learning about how autistic women are more vulnerable to PTSD, please click on the video about autism traits in women.